Stroke is the fifth cause of death in the United States and is a leading cause of serious long-term disability. The following presentation will discuss the current situation of stroke patients, technologies that can be utilized in stroke survivors' rehabilitation, and propose a potential design solution. A stroke occurs when a blood vessel that carries oxygen and nutrients to the brain is either blocked by a clot or burst. When that happens, part of the brain cannot get the blood it needs, so it and brain cells die. Symptoms of stroke include trouble walking, speaking, and understanding, as well as paralysis or numbness of the face, arm, or leg. As I just mentioned in the last slide, stroke can be caused either by a clot obstructing the flow of blood to the brain, called an ischemic stroke, or by a blood vessel rupturing and preventing blood flow to the brain, called a hemorrhagic stroke. These are the two main types of stroke. Data from Heart Disease and Stroke Statistics 2020 published on Circulation of American Heart Association indicates that both Caucasians and African Americans in the United States more commonly suffered from ischemic stroke. Many common medical conditions can increase your chances of having a stroke, including high blood pressure, diabetes, obesity, smoking and drinking, heart disease, hyperlipidemia, and so forth. The effects of a stroke depend on several factors, including the location of the obstruction and how much brain tissue is affected. However, because one side of the brain controls the opposite side of the body, a stroke affecting one side will result in neurological complications on the side of the body it affects. As a leading cause of serious long-term disability, stroke reduces mobility in more than half of stroke survivors aged 65 and over. Recovery time after stroke is different for everyone. It can take weeks, months, or even years. Some people recover fully, but others have long-term or lifelong disabilities. Not only does it cause physical problems, but also mental problems. Patients with stroke are at increased risk of depression. Approximately one-third of stroke survivors develop post-stroke depression, and the frequency is highest in the first year after stroke. Suicidality is also increased after stroke. Stroke survivors with mobility impairments encounter various difficulties in their daily lives. Even the simplest tasks require extra efforts. Without systems in place to support them, there could be additional negative psychological impacts. This could ultimately lead to feelings of isolation as they withdraw from society. Hence, an urgent solution is needed. How might we as designers enhance accessibility and improve the independence of stroke survivors with impairments during rehabilitation? How might we design the process in an interesting and innovative way to maintain and stimulate the user's motivation? Rehabilitation at home is needed after they finish treatment in the hospitals. This process can be tedious, depressing, and lonely. Along with the subsequent symptoms, mobility impairments and adverse emotion issues should be considered when designing this rehabilitation interactive system. To keep the motivation of stroke survivors when rehabilitating, I propose a serious game platform that can be used both on VR devices and mobile phones. If games can make children and adolescents addicted, why don't we employ them for stroke survivors to exercise? By conducting semi-structured interviews, questionnaires, and focus groups, pain points during stroke survivors' rehabilitation process will be identified. The interview will not only take stroke survivors as subjects, but also their family members. Family members usually participate in the rehabilitation process. They may discover some details that the patient themselves neglect. Moreover, many stroke survivors encounter a second-time stroke after the first one. Therefore, it is important to involve their family members to better monitor their health conditions. For users who use VR devices, a ring-tilt-based text entry wearable controller will be paired for their unaffected size hand. Since different stroke survivors may encounter different levels of mobility impairment, a ring-shaped controller is easier for them to put on. As a more affordable solution, the mobile app is also available. So why VR? Stroke survivors may stay at home most of the time. The VR system can bring them to different corners around the world immersively, even to fantasy landscapes. Families, photo sharing, and the social functions will also be applied to enhance and improve safety and user experiences. This is one of the games I designed for the serious game platform called Rehabilitation. Re is for repeat, and R is used as a sensor and exercise tool. The game is aimed to encourage stroke survivors to exercise with their upper limbs. Users will be asked to do 2 sets of exercise to win a token. When you get 3 tokens in time, a task is accomplished. Otherwise, it will show incomplete. Besides, compete mode and social functions will be offered when user wants some competition or companion. More rehabilitation games will be provided on this platform. To conclude, the physical and psychological trauma affects stroke survivors' daily lives and their family members. Therefore, a serious game platform designed for stroke survivors to rehabilitate on virtual reality and mobile devices is proposed. In this way, games can stimulate the motivation of stroke survivors and encourage them to exercise as often as possible. Moreover, by chatting with other users, social needs can also be fulfilled in the game so that they can know other stroke survivors and mitigate the feeling of isolation and loneliness. Thanks for watching.